Good afternoon. Welcome to this news conference hosted by the Prime Minister of Barbados, the Honorable Mia Amora Motley. This afternoon, she is accompanied by other officials in the government, including the Chief Medical Officer of Health, Dr. the Most Honorable Kenneth George. We also have Head of Isolation Facilities in the country, Dr. the Most Honorable Corey Ford, as well as the Minister of Health, the Honorable Ian Gooding Edgell, and the Minister of Tourism, the Honorable Lisa Cummins. First, we are going to hear from Dr. the Most Honorable Kenneth George. Good afternoon, Dr. George.
Good afternoon, everyone, and it's a pleasure to be here. The Ministry of Health and Wellness, and indeed the Government of Barbados' overarching goal has been to safeguard people's lives and their health. In this regard, the public can be continued to be assured that our policies and decisions remain the same. They are as follows: to communicate with the public as necessary, to limit the spread of infection within the country, to ensure that healthcare resources are made available, to limit the impact of COVID on critical healthcare services and delivery, to consider the societal consequences of our decisions towards limiting the impact of this pandemic on people and businesses, and to ensure that the right measures are taken at the right times. As we have indicated before, we are on the downslope of the Omicron wave. I would like Barbadians to know that in moving forward, our purpose is living with COVID safely. And if we take that mantra, living with COVID safely, it should be able to guide all that we do in Barbados. The Ministry of Health and the EOC has taken some decisions. Those decisions have been taken looking at the public health both internally, regionally, and internationally. And I would like to assure you that those decisions are being taken cautiously and purposefully. At the same time, we are working with other entities across the public and private sector to make sure that our economy gets back on track. I am indeed happy that schools are reopened. And I am indeed happy that based on a few visits to the airport, it appears that our visitor arrivals are up. So I think we are going in the right direction. I would just continue to urge Barbadians to do the tried and tested things that we have been saying for the past 2 years. Physical distancing, that's at 3 feet. Hand sanitization. Knowing your status if you are being exposed, and getting vaccines which are available at multiple sites across Barbados. Thank you so much.
Thank you very much, Dr. George. Next, we hear from Dr. Corey Ford, who will update us on matters relating to isolation facilities in the country. Dr. Ford?
Good evening, Barbadians. Thanks for this opportunity to give an update to you on what's going on within our isolation centers. As normal, this evening I'd like to start off by thanking today our nursing fraternity in terms of our Barbadian nurses, our Ghanaian nurses, and our Cuban counterparts who've worked tremendously hard to help this fight within the isolation centers and who continue to give their best in a very difficult situation. But this evening, we have, I think, some things really that we are quite happy with in the isolation centers. We're able to drop our numbers. We have a total of 22 persons between our 2 ICUs, and we're amalgamating our ICUs as of today. We have currently 3 persons who are on ventilatory support, 1 who is intubated, The other is on non-invasive ventilation. As I've explained before, it's just a mask on the face which pushes oxygen in. Of that number, 2 of them actually have a very poor prognosis. The others are actually doing quite well at this particular point. The last time we spoke, you would have remembered me actually saying we had at least 15 elderly persons, certainly be above the age of 80 years of age. And in that group of 50, we were able, and we're quite happy, we were able to get, at least at this point, 8 of them home. Unfortunately, we've had 3 deaths within that population, and we admitted another 5. I would like to congratulate Barbadians on one particular aspect. I think since the last conversation, what we've seen certainly in our assessment centers is a pickup in persons coming to the assessment centers to be seen and to be assessed. And in that particular group, we were able to pull out some individuals and actually have them admitted for very short periods of time to correct things that if they were staying at home, for example, they probably might have been challenges. So I want to congratulate you for that and continue to advise you. If you feel unwell, if you have any challenges with the elderly and you're not sure, I'm asking you to continue to bring them in for assessment of facilities. That's my brief update from my isolation centers. Thank you.
Thank you very much, Dr. Ford. And now, from the Minister of Health, the Honorable Ian Gooding Edgell. Minister Edgell, what do you have to share with us?
Good afternoon, fellow Barbadians and members of the media. 2 weeks ago. Good afternoon, fellow Barbadians and members of the media. 2 weeks ago, February 12th, I had the honor to give you an update on the ministry's management of the surge in COVID-19 cases. On that occasion, I announced that in order to move the country back to opening, the curfew will be lifted. I thank you for the responsible behavior and the way in which you have socialized and conducted business since the curfew was removed. We've had no spike in cases, and the positivity rate has been declining. I thank you again and encourage you to apply the same responsible behaviors as we continue in this COVID environment. In addition, I indicated then that the 6-week physical distancing rule would no longer apply, except where persons exercise together outdoors without wearing a mask. In all other cases, the physical distance remained at least 3 feet. I also announced the resumption of hiking, the restoration of pleasure craft and private chartered boats for private cruises, and cruises operating 100% of their authorized capacity. No restriction on beach activity and parks, cricket capacity at 80%, and allowed public service vehicles to increase the authorized number of sitting passengers from 75% to 100% while wearing no masks. While carrying no standing passengers and wearing their masks. Since the removal of the curfew, the Emergency Operations Committee has met 6 times. As you're aware, the AOC reviews the criteria, such as scientific tools and benchmarks, to analyze key trends and changes in managing any public health crisis. The advice of the Emergency Operations Center has always been based on the science and an acute understanding that we have to embrace economic and social recovery in order to sustain growth and development. As you will recall, when I spoke to you 2 weeks ago, I indicated that the factors which guided our decision-making were trending in the right direction. This continues to be the case. The positivity rate is now at 17.5%, down from a high of 26% 4 weeks ago, and the R effective, the ability of the virus to spread, is below 1 at 0.72%. In addition, the 7-day cumulative cases currently standing at 514 per 100,000 population is trending downwards. The doubling time, which measures the growth rate, continues to increase, which is also indicative of the slowing of the growth of the outbreak. In fact, during the last 4 days, February 22nd to the 25th, the positivity rate averaged 17%. This tells us that 83% of all persons tested on a daily basis do not have COVID, an improvement of the 75% rate that existed 2 weeks ago. These factors indicate that the COVID situation in Barbados is under control and getting better. Schools have reopened, and so far, and based on reports by the Ministry of Education, Technological and Vocational Training, this process has been relatively smooth, and there have been no cases reported to the Chief Medical Officer for investigation. This is a tribute to the cooperation and discipline of parents, students, teachers, unions, parents-teachers associations, and all other parties, and must be highly commended by the entire population of Barbados. As a responsible ministry, we will continue to take a steady but cautious approach, always taking the prevailing public health situation into account as we move towards a new normal in a COVID environment. I take this opportunity to remind Barbadians that we are still in a COVID pandemic, and case counts, while falling, still remain unacceptably high. Based on the Emergency Operations Committee direction, the Ministry of Health and Wellness has decided that the testing protocols be changed. Accordingly, the rapid antigen tests done within 1 day of arrival into Barbados will be accepted. This is expected to improve compliance by visitors. The rapid antigen tests are now being standardized as an entry requirement by many countries, including those in the region such as Jamaica, Grenada, St. Vincent and the Grenadines, and beyond our region in the United States of America, with Canada and the UK set to change their policy within days. Also, nasal swab and mid-terminate swabs will be permitted, in addition to the nasopharyngeal and oropharyngeal swabs. These measures will allow visitors greater ease and more seamless movement through our air and sea ports. In transit, passengers who have a negative rapid antigen or a negative PCR test will no longer be tested at the Grantley Adams International Airport. Self-administered swabs, shallow nasal swabs, and saliva tests will not be accepted. Our port health management and the COVID teams continue to do an excellent job in detecting infection at our borders and reducing our incidence of infection on island. To demonstrate the point, COVID cases among travelers in Barbados for January and February up to the 22nd were as follows. In January, of the 16,002 positive cases detected in Barbados, 300 travelers were detected at the border, which represents a risk of 1.9%. Up to February 22nd, of the 9,204 positive cases recorded, 75 cases were detected at the border, which represents a risk factor of 0.8%. These positive cases are captured at our entry ports and are not able to contribute to our incidence of positive cases since they are immediately isolated. As a result of the process of detection and isolation at our borders, based on the cases picked up at our borders, there is zero multiplier effect from travelers in the community. This is instructive to note that based on internal analysis, imported cases, COVID cases, detected at our border represents less than 10% of the total cases on island. The Minister of Tourism, the Honorable Lisa Cummins, was briefed on these new entry requirements, and I'm pleased to let you know that the Ministry of Tourism and International Transport has already updated the change to the Barbados Travel Protocol on the Barbados Tourism Marketing Inc. website, and this notification was issued to our partners in the international market to encourage them to pack their bags and head to Barbados. Last Saturday, February 19th, I led a team consisting of representatives from the Ministry of Health and Wellness, the Ministry of Tourism, Grantley Adams International Airport officials for an on-the-spot review of public health entry requirements and concerns regarding congestion at gates 14 to 16. At that meeting, we agreed to reconfigure airport logistics and move away from gates 14 to 16. In addition, we reviewed the processes put in place for arriving travelers at the airport since the beginning of the pandemic, analyze data on different levels of sensitivities with different sample types and different tests. A follow-up visit was done by Dr. Anton Best, the Deputy Chief Medical Officer, and Dr. Ingrid Kommerbatch from the Ministry of Health and Wellness. Having further reviewed the processes and analyzed the flow of passenger traffic and arrival data for the port health purposes, the Ministry of Health and Wellness, in conjunction with the Ministry of Tourism and Management at the Grantley Adams International Airport, have decided to make critical changes to improve the visitor experience at the Grantley Adams International Airport. These changes include the discontinuation of the buses used at the airport to transport persons from the aircraft to gates 14 to 16, the relocation of COVID inspections to the main arrivals hall, new passenger flow-through arrangements, the removal of banding except the red band for visitors exiting the airport and arrival at their quarantine location. Simply put, passengers leaving the aircraft will now go directly to the arrivals hall, present proof of vaccination and negative rapid antigen test or negative PCR test to the port health and COVID teams, complete the ED card, and exit immigration. Last night, due to a maintenance glitch, the Minister of Tourism and I, along with the CEO of the airport and other representatives of both ministries, had the opportunity to witness the enhanced arrangements put in place to ensure a more efficient visitor experience, which started last night. These improvements are intended to remove the worrisome situation of congestion that had been occurring at gates 14 to 16 under the old arrangement. Working together, both ministries were able to make critical changes to improve the visitor experience while satisfying port health entry requirements and protecting public health. The BIMSafe application, an app used by travelers to upload their vaccine test results and ED information, continues to be a useful tool and is still a work in progress. Based on year-to-date information supplied to me, 96% of all arriving passengers who use the BIMSafe app, or 43,332 out of 50,157 ED forms filed, did so using the BIMSafe application. The benefit of completing the BIMSafe app allows for a faster flow-through at port health and immigration. I wish to thank the teams at the airport, including public health nurses, the lab test validators, and the BIMSafe team for their continued cooperation as we work together to manage public health entry at our ports. On a related matter, the Ministry of Health and Wellness has proposed some changes to the directive that will come into effect on Monday, the 28th of February. Wedding receptions will be permitted in accordance with the protocols. Dancing at weddings will be allowed. There will be no restriction on the number of persons attending weddings subject to the physical distancing requirements. The provision that no person shall consume food or drink inside a bar or rum shop will be removed. The work from home requirement will also be removed. Standing passengers will be allowed as specified and according to vehicle carrying capacity. The Ministry of Health and Wellness is no longer recommending business houses, churches, and retail shops to record the contact information of their patrons entering such establishments. However, hand sanitization and temperature checks must continue. I wish to make it clear that where churches and other places of worship are concerned, that there is to be no limitation to the number of persons who can gather for worship, but that the requirement for the 3 feet spacing, hand sanitizing, and mask wearing will remain. These same conditions will apply to funerals. As I indicated 2 weeks ago, once the return to school was successful, I would turn my attention to the reintroduction of sporting and community-based events. Yesterday, I met with the Honorable Charles Griffith, Minister of Youth, Sport and Community Empowerment, along with representatives from several other sporting disciplines. We listened to the several organizations present at that meeting and received their feedback in preparation for the phased reintroduction of sporting events. The Chief Medical Officer has indicated that the approach to be adopted will be a risk-based one, taking into consideration indoor versus outdoor activities and contact versus non-contact sports. As agreed at yesterday's meeting, the Ministry of Health and Wellness submitted the risk-based metrics to the Ministry of Youth, Sport and Community Empowerment for their examination in consultation with their partners and stakeholders. We also decided that the governing bodies for sporting organizations who currently do not have protocols will urgently develop and submit their protocols to the Ministry of Youth, Sport and Community Empowerment and to the COVID Monitoring Unit. We are working towards a purposeful reintroduction of sport within 2 weeks in a risk-based manner to ensure the safety of players and spectators, and my ministry will continue to work with the Ministry of Youth, Sport and Community Empowerment and the sporting bodies for the urgent reintroduction of sporting activities in Barbados. Although all indicators suggest that the COVID situation is under control and getting better, I must re-emphasize that personal responsibility continues to be critical to us maintaining control of the COVID situation and reducing the positivity rate. We are not yet into safe harbor, but we must maintain that spirit of cooperation and responsibility so ably demonstrated by all Barbadians to minimize the effects of this outbreak. As I've said before, all indications are that we will continue to live, work, and socialize safely in this COVID-19 environment for some time to come. Barbadians, like other human beings, have had to adapt their way of life to previous health and other challenges. We have done so successfully and have been able not only to survive but to thrive, grow, prosper, and develop as a society. I have no doubt at all that we can and will do more of the same to the ongoing success of our beloved native land. I thank you.
Thank you, Minister Gooding-Edgell. Next, we hear from Tourism Minister Lisa Cummings. Good afternoon, Ms. Cummings.
Thank you very much, David. Good evening, Barbados. I wish to take this opportunity to speak very briefly about the Grant Lee Adams International Airport and the changes that have been made, first of all, to our travel entry protocols in collaboration with the Ministry of Health, and the changes that have been made at the Grant Lee Adams International Airport itself in terms of the entry and the arrival processes. Now, I think over the last few weeks or so, we have been working to address some of the congestion issues, and there are a couple of pressure points that I want to speak specifically to. A number of visitors coming from our primary source markets have expressed difficulties with being able to access the appropriate test to enter Barbados. Many Barbadians as well returning home from travel, visiting family and friends, and students coming home on holiday to join their family here have expressed difficulty, in particular coming out of the North American markets to access the PCR tests required for Barbados. We have seen, as mentioned by Minister Gooding-Edgell, that all across the Caribbean there are examples where the rapid antigen test has been used. The US a few months ago began to accept rapid antigen as an entry test, as did the UK, and Canada became one of the only markets which still required a PCR test for entry. What that meant for travelers was that it became very difficult to identify a site where they could get the specific test required for Barbados. And the result of that, once arriving here in Barbados, was that significant numbers of persons were found to have an unacceptable test, and that resulted in retesting at the Grant Lee Adams International Airport at the gate 14 to 16 area. By transitioning under the direction of the EOC and the Ministry of Health to accepting rapid antigen, as is done in countries all around the world, that immediately eases that challenge, and travelers can avoid now incurring the cost in some instances of accessing, first of all, a PCR test, and in some instances having to repeat that test on more than one occasion. And so we're very happy to be able to afford visitors that ease of entry to Barbados while maintaining the safety at our borders. What that has meant is that the change to be made in terms of moving from gate 14 to 16 back to the arrivals hall is a significant change in the process flow to the airport. Now, gate 14 to 16 was not designed for what it was, but we're very happy that the management and staff of the Grant Lee Adams International Airport were able to accommodate the Ministry of Health in that area for the last 2 years. We are now, and we began it last night, we're accepting passengers now getting off of their aircraft and walking via gate 13 down to gate 9 through the arrivals hall, and anything above gate 13 through 16 on the western side of the runway, we will still have to use transportation because there is quite a distance. But for all passengers landing, for the majority of passengers landing in Barbados now, there will no longer be the use of the buses, which were being used only to facilitate transit to gate 14 to 16. And so now persons will be traveling directly from the aircraft on foot via the walkway at the airport. The immigration and the customs teams, I want to take a moment to commend them as well. They have worked extensively with us over the last few weeks, and we expect that within another couple of weeks, we should have an updated advanced online ED form. The new version 2 is being prepared, I believe that over the course of this weekend, that draft is going to be presented to Minister Abrams, Minister of Home Affairs, for review, and then we should have the final collaboration completed during the course of the coming weeks with JRCC at the regional level to make sure that we are in place with the Advanced Passenger Information System. That we expect will further ease the movement through the arrivals hall for passengers. There has also been a further collaboration with our customs team, and we're hoping to be able to work even more closely with all of the customer service agents. We want to thank them for all that they have been able to do at the Grantley Adams International Airport. Finally, I wish to share that we have begun to consult as at yesterday with all of our travel partners. We met with all of our travel partners from all of the major markets yesterday afternoon, and we have begun to notify in all of the markets as at yesterday afternoon and continuing over the course of the coming days to update all of our travel partners, travel operators, tour operators, and all of our airline partners have already been notified in partnership with our overseas offices of the new changes, and they have received these changes warmly. So finally, I just want to thank everyone at the Ministry of Health for working with us, Minister Gooding-Edgell for his leadership, and we want to continue to encourage Barbadians to be cooperative with officials at the Grantley Adams International Airport so we can ensure that you have the best possible arrival experience when you land at Grantley Adams International Airport. Thank you.
Thank you. Thank you very much, Minister Cummins. Well, next we will hear from Prime Minister Mia Mottley. Prime Minister Mottley.
Thank you very much, David. I'd like to start this afternoon by thanking all who have spoken. Dr. George, Dr. Ford, Minister Gooding-Edgell, Minister Cummins. I think that all of us will agree that you've had a comprehensive briefing from all this afternoon. And my task is really therefore very easy. We are not out of the woods, but we are in a better position, significantly so, than we have been for some time. And as a result, we have promised you from the beginning of this pandemic that we would approach this with the attitude of pressing gas or pressing brakes. There have been occasions when we've had to tighten down, and there are occasions when we are able to remove the restrictions. We are in that process of removing restrictions, and I will not say for us to go back to normal, because there can be no normal after COVID-19, but for us to go back to increased activity that will allow people to live and to be able to pursue their lives with vigor, but at the same time safely so, as you've heard from Dr. George and Minister Gooding-Edgell. Safety must be paramount, but we cannot continue to live as if we have nothing else to do besides manage COVID. As a result, the government of Barbados would have taken a decision yesterday. The Cabinet Subcommittee met with the EOC, and we have agreed that there shall be the return to work by the public service from the 1st of March, which is Tuesday. And this is a significant departure because, as you know, over the course of the last 2 years, for the most part, we've had some level of remote activity. And even though in the third quarter of 2020, we saw increased attendance back at work, once Alpha became a reality at the beginning of 2021, for the most part last year, we had remote work in the public service. It is our judgment that it is safe for persons to return fully from the 1st of March. What does that mean in real terms? That there will still be elements of flexible work. As you know, prior to the establishment of the regime for the pandemic, the social partnership had advised and the government had accepted a regime of flexible work. And what does that mean in simple terms? That those persons who will partake in flexible work must receive the consent of their head of department and their permanent secretary. But it will not be a case of all persons operating from at home, as happened in certain departments before. With respect to other aspects of activity, the Minister of Health has indicated the other changes. Minister of Tourism has indicated the changes at the airport. And with respect to weddings, we've indicated that dancing can now happen. With respect to rum shops, the prohibition that would have stopped people participating inside has now been removed. And with respect to sports, the issue is that over the course of the next few weeks, whether it is tabletop games, whether it is contact sports or non-contact sports, the consultation between the Ministry of Health and the sporting organizations will allow for certainty with respect to persons being able to get back into their activities as they so much would love to do. Let me come now to the issue of entertainment. And while permission for entertainment events must still be channeled through the National Cultural Foundation and the COVID-19 Monitoring Unit for now, the number of patrons attending an event will be dependent on the size of the venue and not just an arbitrary cap that has occurred before. That consideration of the size of the venue and roughly the ability to allow people to adhere to the 3-foot distancing rule will determine what those venue numbers will be. And of course, that will vary from venue to venue to venue. The minimum requirement for attendance will continue to be that persons be fully vaccinated or show a negative rapid test taken at least 24 hours prior to the event. We do know, however, that service providers and technical crews must be fully vaccinated and must also test negative, and that is because they have a duty of care to the persons attending the event. The big elephant in the room and the big question for all Barbadians is crop over. What happens for crop over? We are satisfied that we can have the season of emancipation and a modified crop over season, and I'm sure that all Barbadians will be happy to hear that. What does this mean in real terms? That the staging and execution of Grand Kadooment and 4-day mourning, which of course would be the two events that would normally give the Ministry of Health their greatest concern, we've now agreed that we will decentralize this such that we will have at least 8 venues that will accommodate persons wanting to play Mass for 4-day mourning and for Grand Kadooment. And it means that those persons who will attend those decentralized venues will have to adhere to the same rules that fetes, persons attending fetes, will adhere to over the course of the next few months. We are happy for this because we know that after 2 years of no crop over and no release, people are more than waiting for this opportunity. But as you've heard from Dr. George, we will continue to live, but safely so. We believe that if we have those 8 venues properly fenced and with the protocols that we've just announced, that we will be able to welcome not only all Barbadians here, but all of the visitors to our island who look forward to this really being one of the first, I almost said carnivals, one of the first more than a carnival type events that can happen in the region, having had, of course, to miss those that have been normally would have come in the early part of the year, like Trinidad Carnival and others. So my friends, the consultations as to the refining of the specific events will take place next week. Minister Chantal Monroe-Knight, along with the CEO of the National Cultural Foundation, Mrs. Carol Roberts-Reefer, will meet with all of the stakeholder groups to be able to refine exactly the types of events that we will have. We are satisfied, having discussed with the Ministry of Health and the COVID Monitoring Unit, that it is possible for these things to take place safely, subject, of course, to there being no intervening event that makes our situation worse. And thus far, we are reasonably satisfied that we are on the right trajectory, not just locally, but globally. But we continue to watch and continue to adhere to the principle of gas and brakes where necessary. This is a difficult time generally, and there's some who may wonder, well, what next? The truth is that the war that is broken out in Ukraine will have implications for the cost of fuel, will have implications for the cost of food, will have implications for the supply of food and for other things too, because we do not know to what extent the supply chain globally will be further disrupted. I say these things because we believe that against that backdrop, the stress of the world in which we live requires people to have a little mental break and a little mental ease. And we know now how much mental wellness means, particularly when this pressure and stress comes at us 24/7 and at 100 miles per hour. So Barbadians, we hear you, we feel you, and we believe, as we have done over the course of the last 2 years, we will allow for activities to take place once we're satisfied that there is safety. We are at the stage where we want to thank also those who have been on the front line of managing this last outbreak with Omicron, We know the pressure it has put on the persons at Harrison's Point and the other related campuses that have literally had to manage the thousands of Barbadians who became sick. We also want to thank those who helped us with the at-home programs for isolation and quarantine. And we've also made changes, as you know, to who ought to quarantine and when and how, because we recognize that you can't just be taking people out of work for 3 days in circumstances where the testing regime really matters on day 3 and not on day 1 and 2, where the level of contagion, I am told by the doctors, is not, the risk for contagion is simply not there in day 1 and day 2 after exposure. So against this backdrop, we thank Barbadians once again, truly, truly, truly. We could not come to this point. We cannot be going in this direction without the cooperation of the majority of Barbadians. We urge people to continue, those who have not taken vaccines, to please do so, and those who have taken, there's more than enough for boosters. Please get your booster. The evidence is absolutely clear that the vaccinations and the boosters do help you and protect you against severe illness. And we regret all who have passed over the course of this pandemic, but we say that we have and can continue to keep our numbers down if we continue, 1, to vaccinate and to boost vaccinations, and 2, to follow the other protocols that have been absolutely essential from day 1, and we don't tire in repeating them: the mask wearing, the hand sanitization, the social distancing where possible. And my friends, if we do all of these things, we therefore can be assured that we will be in a position to move forward. I felt that it was important to come and speak and to support the ministers and the public officers this afternoon. I haven't spoken to you on COVID for a while. I'm here to answer any questions from the media with respect to that. The heads of government meeting is next week, and the regional level, the heads will be taking stock as to where we are regionally with respect to COVID. We are still awaiting the vaccines for the 5 to 11-year-olds from Pfizer. As you know, those are specialized vaccines that are made available, and the procurement issues have not been fully resolved. We have been treating to this at a regional level through CARICOM Secretariat, and therefore next week when we meet in Belize, I believe we will be in a better position to thank everyone. I go from Belize to Ghana. The government and people of Ghana have asked me to be their special guest to address them on the 65th anniversary of their independence. As you know, Ghana was the first black country to attain independence in this world in the 20th century. And Ghana has been that country that has helped us out in this very difficult period with the pandemic, with over 100 Ghanaian nurses coming. And therefore we go not only to wish them happy independence, but to thank them from the bottom of our hearts for helping this country when we needed it most. So my friends, we are more than available to answer your questions now. David, before I hand back over to you, a little birdie told me that it is your birthday, and on behalf of the persons here, and I'm sure all of Barbados, we would wish to wish you happy birthday. Thank you.
Give public service on my birthday. The way that I'm going to proceed with this session is that I'm going to fuse comments, questions from the press with some from the public that I believe are relevant to the issue before us. And therefore, I'm going to come to the press first of all. Good afternoon.
Hi, good afternoon. Yes, Colville Munzi from Nation News. I have 2 questions. Firstly, my first question will be directed to the CMO. Now, some sections of the medical fraternity are raising concerns about the level of testing, and therefore the concern is that given the fact that we are testing numbers of around 1,000 and under, making an accurate prediction as to where we stand as it relates to the current wave is not exactly feasible at this time. Could you respond to that for me, please? And also, my second question would be directed to the Prime Minister. Prime Minister Motley, you mentioned about the Ukraine crisis. I just want to shift gears to that quickly. What mitigation measures is your administration working on at this point to address some of the fallout that you would have mentioned and other pundits would have mentioned as well that we could be facing in the long run as potential?
So, good afternoon again. When we were in the previous two waves, the mantra was know your status, and we were encouraging Barbadians en masse to be tested and know your status. Around the world, though, that has changed a bit, and with respect to Omicron, which is highly infectious, there are a few issues you need to know. First, there was a shortage of testing, tests that were available on the international market because the amount of persons who would consider to be exposed would have been high, and therefore you certainly could not test everyone. So we have shifted a bit, and I've tried to let the public know that as each wave comes, we have shifted our approach. We have moved from knowing your status to knowing your status if you have been exposed. So that is my good advice to the nation, knowing your status if you have been exposed. It is difficult for us with a very infectious virus to have people en masse being tested. This is the flexibility that the Ministry of Health has used over this long period of 2 years, and it has worked us well. So my advice to persons is that if you were in contact with a positive case, you should be tested. But with respect to everyone in the population knowing their status, we have moved away from that type of direction.
Thank you very much. With respect to the issue of what steps the government has taken, let me say, Colville, that we have been monitoring this situation for some time. And it was as a result of this and general disruptions in the global supply chain that we started to meet with the private sector from late last year. It is also why I've taken a peculiar and particular interest in ensuring that we can boost food production in the Ministry of Agriculture in order to make sure that Barbados is in a better position to feed itself. It is also why when I went to Guyana week before last that we would have discussed with President Ali the urgent importance of having the Barbados-Guyana food terminal established. And as we go to CARICOM heads next week, yesterday we had a meeting of COTED discussing the plans to allow us to literally produce 25% of the food that is now being imported by 2025. The urgency of the moment with the Ukraine crisis is undoubtedly there, but we have been preparing for some time for this unstable world, which has led to increase in food prices, and because of the climate crisis, restrictions necessary with respect to how we can get goods moved and how we can get goods affordably here. One of the things that I will discuss and let me say it, we are hoping to be able to have a broader discussion with the Barbadian public in the next few weeks, and I'm not going to make those announcements today, but suffice it to say that in about 2 weeks' time we should be in a position to show what other things we will do to help contain the cost of living issues, particularly as it relates to food. So these are some of the things. The price of oil obviously continues to be volatile. Over the course of this last month, we've seen the price of Brent crude, for example, move from 90 to 100 back down to 96, 97, and we expect that volatility to continue. That is why in the medium term, moving to more renewable energy matters, but you can't snap your fingers and have that overnight. And finally, our reserves are at such a healthy stage, still over $3 billion, still roughly at about 37 weeks of import cover, that it means that we have more than adequate buffer to be able to deal with the capacity to manage increased prices. But what it does mean is that if we spend more money in this particular area, we will have less money to spend in another area. So there will be implications for how we manage going forward, but it is not the worst news, but we are prepared to do what has to be done at the macro level and also with respect to cost of living for households as we go forward.
Okay, Prime Minister, I'm fusing information that's been sent basically via WhatsApp and some that I've seen on the live YouTube response to some of what has been said. One person points out that in the case of Britain, 80 to 90% of the adults there were fully vaccinated, and they're suggesting that it is against that kind of background that they are able to relax measures, whereas in Barbados, they point out, we are around 55.1% of the vaccinated. This other person now on YouTube says 130,000 Barbadians are not vaccinated, and in their judgment, the risk remains very high. So, who responds to that?
Simply to say, David, that the proof of the pudding has been in the eating. We were told that Omicron would give us 3,500 to 4,000 cases a day. We've not seen that. And we have taken the advice of the Ministry of Health. We have been very careful about what we have done. We've been very guarded and gradual. We've taken criticism for being gradual in what we are doing. And thus far, I'm satisfied that all the advice that we've gotten and the decisions that we've taken have allowed us to go generally in the right trajectory. As I said, one person dying is way too much, but the numbers that have died in Barbados are literally way below most countries in the world. With respect to the positivity rate, that has also declined. With respect to the RE rate, as you call it, that is also now below 1. And I think that we need to recognize that the numbers of persons who are vaccinated are almost at 70% with the first dose. And what matters, of course, is the fact that of the eligible population. And why do I say so? Persons under the age of 12 cannot be vaccinated. So that if you count those into your absolute numbers, you will always get a lower rate because there's no vaccine available for them, period. So let us judge ourselves by those who can, and let us judge ourselves by the advice given by the Ministry of Health. Let us judge ourselves by the experience of what that advice has led to. And in every instance, in fact, I think we may be in the awkward position, quite frankly, of having more staff now than patients at Harrison's Point. And those adjustments have to be monitored very carefully. You're not obviously going to dismantle that overnight because we can always go back up, as you know. But suffice it to say that after an election, after the beginning of this year with Omicron, that I really do think that any independent assessment of Barbados would show that, relatively speaking, we've done a reasonable job in managing and containing this particular outbreak. But we're not resting on our laurels, nor looking for praise, quite frankly. What we are looking for is to get through each day safely, day by day by day. And I think we're going in the right direction. Let me say also to those persons that, as I've said, Barbados is not a one-issue country. And that if we tried to address COVID and COVID alone, then we would have heightened unemployment, we would have social implosion, and we might even have increased crime as a result. So we really do need to recognize that we have to walk and chew on this journey. Thank you.
Another question from the news media.
Yes, good afternoon. Trevor Thorpe here, CBC News. You said there'll be a modified crop over, Madam Prime Minister. Does that mean that we will be having a crop over the north, crop over south, crop over east, that kind of thing? Or this decentralization of it would mean greater places in St. Michael?
Trevor, I might have been born in St. Michael, but Barbados is not St. Michael. And I therefore think that if we're going to have at least 8 venues, then the 8 venues will be all over the country.
That's why I asked if the crop over north and the crop over south.
But I think you answered the question for yourself. Then what I will not be able to tell you is what the names of the 8 venues are. So I can't tell you whether it's north, east, west, south, north, south, northeast, northwest, north, whatever. Suffice it to say that there will be. Well, I'm sorry for so doing. I apologize.
But I'll wait for more information from you, Madam Prime Minister.
As I said, not from me. The Minister Monroe Knight and Carol Roberts and the stakeholders will meet next week, and it is for them to refine what those venues are. Will it be Bushy Park? Will it be the Botanical Gardens fenced in? Will it be Kensington? I don't know, and I'm not going to prejudge it or even guess. Leave it to those whose business it is to come up. Suffice it to say that the Ministry of Health recognizes that if we can determine how people go in there, that they have the rapid antigen test within 24 hours and that they're vaccinated, and that the numbers are controllable by some kind of physical barrier, which is usually fences, then people will just have the jump up, but in a different way. In Trinidad, when you go to Carnival, there is no one long road for everybody. People take different roads while jumping up in Port-of-Spain. So they have a form of decentralization, even if different. And we will just think outside the box to give people that experience, while at the same time adhering to Dr. George and the Ministry of Health officials for safety to be paramount.
Do we have another question from the press?
Yes, we do. Good afternoon. With all of the ease and restrictions towards living with COVID safely, bearing in mind that Kadooman can be as much exercise as, say, jogging or cycling, how would this affect protocols towards masking by August?
So, and that's what I had indicated in the first part of my presentation. The landscape in a COVID environment changes all the time. So I don't want to predict, as we have indicated that, and as the Prime Minister has stated, that we will try our level best to make the site safe. But I cannot speak to the issue of mask wearing. Mask wearing is currently required in Barbados, but crop over is a few months away, and you are well aware that information changes quickly in this environment.
This person...
If I
sorry,
may, David, there was a
Prime
question earlier about the testing rates, and the Minister has passed to me the fact that, and I'd like to read it because I think it is important that people have context, that in the last 2 weeks of the reporting period, the PCR testing rates have decreased by 26%. However, over the outbreak, the population testing rate, that is 20,755 per 100,000 population, remained well above the recommended minimum threshold of 1,500 tests per 100,000 population over 28 days. And this is the recommended threshold from CDC. So they recommend 1,500 per 100,000, and we have been at the rate of 20,755 per 100,000 for this period. The percentage, yes, has continued to decline for the week ending February 19th from 26 to 20%.
Thank you.
So generally, even though our numbers appear to be low, it is still well above the testing rate that is recommended. Thank you.
This person says that long-term COVID is a reality, and they want to know what steps are taken to assess this in our population.
And I will say something.
Thanks so much for the question. If I understood what was asked just now, is the reality of long-term COVID within Barbados in terms of the number of people who've had COVID, whether people be asymptomatic or symptomatic. So the easy answer to that is, and we have to look at what's happened globally. And I always have said over and over again, we have to look at what happens globally and look at our own local picture. Persons who've had COVID can have we've said before, can have many challenges, from joint pains to fatigue to mental related issues, etc. And globally, how has this been dealt with, and how, certainly in Barbados, how would we deal with this? I think, again, we have to decentralize something as long COVID. There are thousands of Barbadians who have COVID within the community, and thousands of Barbadians have their private doctors, and thousands of Barbadians see people within the polyclinic sector. And this certainly can continue. So people who have COVID can, like anybody else, certainly go to their private practitioners. If private practitioners decide that there are significant challenges, for example, people may have joint pain, small joint pain, large joint pain, for example, they may present themselves with things like thyroid disease, for example, or even diabetes. And these can be referred to the available specialists throughout the island. What Barbados is special at having is we have almost every specialty that there is across the globe. And certainly they can be referred either within the private sector or they can be referred within the hospital setting. So I think that this is the approach that needs to occur, certainly, and continues to occur within our country at this particular point. And I honestly do not believe there needs to be a central system for this. I think most countries across the globe have moved away from that toward a centralized program of assessing these individuals. We need not to let people within the country believe that COVID is anything different than any other infectious disease. And I think by centralizing that, we might promote that. I think we need to decentralize that type of activity. Thank you.
I think it may be useful in the context of this question to give the person who wrote that some sense of how much of a challenge it is in Barbados.
Well, I think from where we stand at this point, it is not a tremendous challenge. I have seen people, I would say, post-COVID who have had respiratory disease. I think one of the brilliant things within our centers, which our young physicians have always said I'm very thankful for, the clinical acuity is excellent. And what they've been able to do quite early on is to assess this. So there are people who come in who have respiratory disease, and they're automatically referred with conversation with our pulmonary colleagues to the pulmonary clinics, and they continue to be seen. Similarly, for those who are younger, for children, for example, the pediatric population, the pediatrician, and particularly one pediatrician, has been following these cases across the country who have presented with significant symptoms, and they're continuing to be seen within the hospital system. So not only privately, but within our hospital system. So I think as things progress within country, as people progress in terms of their disease, that these particular measures are still in place. We still have active polyclinics who can monitor this. We have active general practitioners within the community who can follow this. And certainly when things become very complicated, certainly there are the physicians and the specialists on the ground who can support this. I think Barbados needs to be confident, and I think we need to project that sense of confidence, certainly within the Ministry of Health, that even post-COVID and with long COVID, that we certainly can beat this. We have really done well, I think, in this pandemic, and that's because I've always said because of good governance, good policy, and because of the people I'm talking to today, and we can continue to do it even in the advent of long COVID. Thank you.
Thank you. Another question from the news media?
Yes, hi, good afternoon again. The final question from me, and this will be directed to the Minister of Tourism. Madam Minister, could you give me an idea? We are just a few months away, I think 2 months or so from the end of the winter tourist season. Could you give me an idea how things are shaping up for summer? And with the announcement of these change in entry protocols, as well as the announcement that there would be a crop over this year within the summer period, how does that change the dynamic for the summer period?
Thanks for that question, Colville. Let's start first of all with weddings, and I know that the wedding planners have been reaching out certainly to us in the Ministry of Tourism because romance is a huge market for summer, in particular coming out of our North American markets, and they're going to be quite excited, and we already have seen their responses coming in from the markets about what that has meant for the bookings for the summer season. We also can see that with the rapid antigen inclusion, that's a big plus as well for travelers, because summer travel is a huge market for families. And so if you're thinking about a PCR test, which can range from 175 to 225, sometimes 250 US dollars per person, and you are a family traveling with 4 people or 5 people, or sometimes groups traveling in larger numbers, it becomes prohibitively expensive. And let's be honest, I think part of the challenge is that Barbados is part of the Caribbean region. People have choices. And so when you have several of our neighbors who have obviously already adopted the rapid antigen and the cost of travel, both in terms of airline travel and then you add on the testing costs, then people can make choices. But when their first choice is Barbados, and for many of them it is, this is a significant boost to our travel bookings for summer. We are preparing to roll out our summer marketing programs in our key markets. It's an extremely exciting program that the BTMI teams and the marketing department have put together in partnership with their overseas marketing teams, and we're going to see some more of that. In terms of the winter season, I think one thing we can be clear about is that coming up on Christmas, into November and so on, there were some concerns, and I think we had a lot of discussion in the public space, and you heard me say that we were not terribly concerned about the initial issues being raised about cancellations, because what we were seeing and what we were hearing from the market was that there are legal requirements in a lot of instances when protocols change or when circumstances change for tour operators to cancel, or to give, rather I should say, to give travelers the option of canceling and then give them the opportunity to rebook if they are willing to travel under changed circumstances. And so we expected that the cancellations would have kept pace with the rebookings, and that is exactly what happened. And then as we went into Christmas, I think in most instances, the lowest occupancy rates that we found ourselves dealing with was somewhere in the vicinity of 82% or so. And as we headed into Christmas and the immediate aftermath of Christmas, we saw occupancy rates up until last week as well. We were seeing occupancy rates across the island, in particular in the A class and the luxury class hotels at 100% and as low as 98%. So I would have to say that we're still reviewing the numbers, we're still assessing in all of the categories, but our season has been extremely strong for winter, and in some instances it has even exceeded the projections for some of the classes, in particular with the hotel rates. But there are obviously some challenges for Airbnb and for the budget class, because there has been limited spend in some of those categories because credit card debt is at a low, savings are high, and so people who have disposable income are spending more and they're taking advantage of that pent-up demand. But persons who may have lost their jobs and who are looking for budget travel may not necessarily be ready to travel just yet. And so the summer program presents a prime opportunity for those persons for budget travel to be able to do that. So I hope that answers your question, Colville, but you will have a far more comprehensive briefing from the tourism stakeholders in another week and a half on what the industry has looked like after we have done a comprehensive review of the winter season, and to share with you the plans going forward, not only for our summer season, but of course projections all the way down to winter 2022.
Is there another question?
Yes, please. One last quick one from me. Based on the ease of restrictions, I was wondering, does this mean that the phased re-implementation of face-to-face classes would be ramped up, or will it proceed at the same rate?
It's the same rate, Ian.
Another question here is how does the accepting of rapid antigen test results at the airport affect the testing requirements for medical facilities? Will rapid antigen test results be acceptable at medical facilities? Who can take that?
Right. So let me be clear. There are some places that require you to either be vaccinated or have a rapid antigen test. And you know that when we had cricket, that was the case. So on a case-by-case basis, we will take risk into consideration and decide if vaccines are required, vaccines plus antigen tests, or antigen tests alone. I don't know if that answers the question.
Okay. Any other questions or any other follow-up to this particular matter? Any other questions from the press? Well, this other question is, it relates to the number of people suffering negative effects of the vaccine. Is this being monitored? This has been a matter that has come up from time to time. the negative effects that we have recorded from persons taking the vaccine. Do we have any of those statistics to share with this person?
So I don't have the immediate information, but let me assure you that there is an adverse reaction against looking at vaccines, and that committee meets about twice a week. I'm involved in that process. There will always be, with any medical intervention, person having side effects. Let me assure Barbadians that the numbers related to vaccine-related adverse effects is extremely small based on the level of vaccines that we have given to the public. But on a case-by-case basis, we have had to intervene. We have put a system in place where those persons are assessed and given the appropriate treatment. I know that there are a few cases still outstanding, but we continue to work in this direction, and that committee's work will continue.
As it relates to churches, there is a question about when people will be able to return to communion from the common cup.
At this present point in time, I go to church. Communion is only given with the bread, and I think that will continue for a little while longer. I urge persons to be patient. Once we have the information, we'll communicate it to the public.
And there was a question too about the length of church services.
So the longer the church service moves on, the likelihood of infection is greater. The 3 feet rule is the overarching policy. We have asked church persons in faith-based organizations to try to end their masses within 3 hours, and that should continue.
Well, thank you very much, Dr. George. I think at this stage we can have some closing remarks from you, Prime Minister.
Thank you very much, David. I think that the general mood here is one of cautious optimism, that we recognize that this has been a challenging period, but that, as you've heard from all of the persons who have spoken here, that we are in a position to be able to reclaim larger aspects of our lives, but we must do so safely. We ask Barbadians, therefore, to continue to work with us. We ask Barbadians to recognize that these removal of restrictions are critical if more people are to get back to work and to earn for their families and to be able to resume the servicing of their debts and their payments. We ask Barbadians to recognize, however, that ultimately that personal responsibility that each of us must accept, reflect, display, that is what is going to determine how we go from here. And I am confident in the way forward. I'm confident in our people. I've seen how we've behaved over the course of the last 2 years, but in particular in the last year when Alpha, Delta, and Omicron have afflicted us. And with that, therefore, I trust and pray that we will allow wisdom to continue to guide us and to allow personal responsibility to be that thing which we follow. With respect to those coming back to work next week in the public service, we look forward to having a full complement again and look forward to being able to do the things that can help this country resume its trajectory to growth. This is a year when we must work towards double-digit growth. This is a year when doing our duty will not simply be enough, but we must go beyond that. And I'll have the opportunity within 2 weeks or so to speak to the country in a fuller way from Parliament. Thank you very much.
Thank you very much, Prime Minister. And our thanks also to the Minister of Health, the Chief Medical Officer in this country, Dr. Kenneth George, and also to the Minister responsible for Tourism, Lisa Cummings, as well as the Head of Isolation Facilities, Dr. Corey Ford. We also want to thank we did do that already, Minister. So I also want to thank the team that has worked with us this afternoon, as well as the members of the media and those of you in the public who shared your questions and concerns and got them answered, we hope. That's it. Have a really, really great afternoon.